Hi, I'm Dr. Pat Cuozzo. Thank you for visiting our website. In this section of our website, we're going to answer some of the most frequently asked questions by our patients' parents. Why you would choose an orthodontic specialist over your general dentist for your orthodontics. An orthodontic specialist is going to have education, experience, and expertise. Education, an orthodontist is a dentist who has gone on past dental school to 2 to 3 years of education in an accredited university to become an orthodontic specialist. Just as there are specialists in medicine, there are specialists in dentistry. The experience, an orthodontist will treat many more cases, see many more things. They will have the knowledge and the experience to handle the case that your general dentist may not know is even a problem. The average length of time in braces is anywhere from 18 to 24 months, depending on patient cooperation. What do I mean by patient cooperation? If the patients miss their appointments, they break their braces by eating things that are hard, sticky, or chewy, and they don't wear their elastics, they will be in braces longer because braces are a stepping stone, meaning you're building a building. You start at the base, you work in very, very light wires, you then step up to heavier wires in order to allow us to move the teeth in different ways. If they're constantly breaking their braces, we can't make those steps, so again, it lengthens their treatment. We prefer to put top and bottom braces on at the same appointment. The appointments to put the braces on are longer appointments. They're usually anywhere from an hour to 2 hours of time. That way, if we put them on at the same time, it's less time in our office, more convenient for you, and it also moves your treatment along a little bit quicker. So again, we prefer to put the top and bottom braces on if the case will allow it. Placing orthodontic appliances does not hurt. As a matter of fact, in our office, we don't even use local anesthetic. It would be the needles that the dentist gives you in their office. We can place the orthodontic appliances and there will be no discomfort that day. The next day, the next 2 or 3 days actually, your teeth will be a little sore, just like if you had pulled a muscle. That soreness will go away as the teeth adjust to the braces. A little Motrin or Tylenol would help that discomfort. Do we apply braces while the patient still has baby teeth? The American Association of Orthodontics recommends an evaluation at the age of 7. That means that we would like to see your child at the age of 7 or 8 years old. That does not mean that they are going to start orthodontic treatment in our office. 10 to 15% of those patients that actually do come into our office need some type of orthodontic intervention. It may not be traditional braces. It may be some type of an orthodontic appliance to change the way their jaw is growing, the way their bones are developing, and the way to create more room for their teeth to come in. So yes, we do treat 7 and 8 year olds, but we don't necessarily treat everyone that comes in our office at that age. The extraction of baby teeth to speed up the process of the development of the permanent teeth coming in. Actually, in certain cases that does work. It actually helps the development of other teeth to come in. It is not necessarily needed in every case, and it is taken on a case-by-case basis. We do take molds of your teeth, and the reason we take the molds of your teeth is it allows us to create a 3D image of your teeth that is digital. On the computer, we are able to actually look at those teeth, to take those models, to rotate them in 360 degrees, to see them from all different angles, from the back, from the top, from the side, which allows us to make a better diagnosis of where we need to move your teeth and to position them. The reason we take digital x-rays of your child's teeth, or anyone's teeth for that matter, is it reduces the exposure to the x-rays. Also, it allows us to see the growth and development of your child's teeth, the growth and development of their jaws, and the way their teeth are going to erupt. We're also looking for missing teeth, extra teeth, and the way the teeth are going to come in. If your child breaks their braces, it does affect the length of time they wear braces. How do you break the braces? By eating things that are hard, sticky, or chewy. Gum, Tootsie Rolls, taffy, things like that are going to break the braces. They are designed to break so that if you bite into something, it protects your tooth. The cement will break and your tooth won't. Well, what happens is we start out in very light, flexible wires and we move to heavier wires. Well, in order to do that, the teeth have to be aligned. If they are constantly breaking their braces, we can't make those steps we need because the teeth are not moving in the direction we need them to. We teach your child how to maintain their braces with good oral hygiene. The reason we do that is because oral hygiene is very important when you have braces on. You will hear people say, my braces scarred my teeth. Braces do not scar your teeth. What scars the teeth is the plaque that sits around the brace. The plaque is the material, it's soft, you brush it off every morning and at night. We ask your child to brush their teeth 5 minutes in the morning and 5 minutes at night to remove that plaque which is causing those scars on their teeth. Very much like when you place a couch on a carpet and it sits there for 2 to 3 years. When you move that couch, you will see a stain on the carpet. The couch didn't stain the carpet, the sun faded it around. Just like the braces sit on your teeth, the plaque sits around the brace and it will scar your tooth. You will hear the people say, braces scarred my teeth. Braces do not scar teeth, plaque does. Very important to remove the plaque from around the braces 2 to 3 times a day, 5 minutes each time. What is a palatal expander? A palatal expander is an appliance that we put in the roof of your mouth on the top jaw. It actually widens the growth plate right down the roof of your mouth and it makes more room for the teeth. It also widens the bone, which allows us to correct cross bites, whether it be on one side or both sides. The palatal widener can correct both. What is a palatal expander and why do you need it? A palatal expander is an appliance that we put in the roof of your mouth that's custom made to your mouth, so it will not hurt. It actually is used to widen the growth plate down the roof of your mouth so that we can make more room for your teeth in order to not to have to extract permanent teeth. So a palatal widener is a very valuable tool for us in orthodontics, allowing us to make more room, limiting the number of extractions we have to do. Our self-ligating brace is a new technology. Self-ligating or frictionless braces are not a new technology. They have actually been around since the late 70s and they have been used since the early 80s and they were called the speed bracket appliance. The self-ligating braces is just one fashion of braces that are available. There are probably 10 to 12 different major manufacturers of braces. Having the opportunity to teach at the University of Pennsylvania Orthodontic Department, I'm exposed to all the different appliances. I have not found there to be any significant advantage to a self-ligating bracket over a traditional bracket, that the kids like the traditional bracket better because they get to choose their color ties that hold the wires into our braces. In this section of our website, if we happen to not cover one of the questions you have, please feel free to call one of our offices and schedule an initial complimentary evaluation. Come in, we will sit down, we will discuss the question that you have and find the answer for you.